Hi everyone, my name is Laura Michelle Castro Chavez. My topic now is acute methotrexate induced crystal nephropathy. Definition. Acute renal failure occurs in approximately 2% of patients who receive high-dose methotrexate for the treatment of a hematologic cancer. Intratubular crystal formation does occur in humans during the course of methotrexate-induced acute renal failure. Certain types of urinary crystals are known to form or they undergo structural modification in the bladder of after maturing because of change in pH, temperature, or bacterial activity. Taking methotrexate for as little as 30 days is known to cause serious consequences, including sepsis and death. Since 2000, at least 8 Australians have died and many more have been hospitalized after taking too much methotrexate. Methotrexate use is increasing, which has corresponded with an increase in accidentally daily done report to Australian Poison Information Centers. Methotrexate is effective and safe if used correctly. We have a video.
Healthcare professionals should know about drug-induced kidney injuries. First, there are three main ways that drugs damage kidneys. Some drugs decrease how much blood flows to the kidneys. Examples include NSAIDs, ACE inhibitors, and ARBs. Some drugs directly injure kidneys. Examples include penicillins, cephalosporins, contrast dyes, and aminoglycosides. Some drugs also obstruct the flow of urine from the kidneys. A common cause is calcium stones from excessive or high-dose calcium supplementation. Second, patients at higher risk may include those aged 60 or older, experiencing dehydration, with diabetes, high blood pressure, pre-existing kidney disease, heart failure, or liver failure, or having recently had surgery or a procedure that used contrast dye. Third, symptoms can occur days or months after starting a new drug. Most mild to moderate kidney injuries do not have any symptoms. People with a severe kidney injury may complain of feeling tired or confused, a sudden increase in blood pressure, a sudden change in urine output, or swollen ankles and weight gain from fluid. Fourth, the most useful lab markers are an increase in serum creatinine by at least 27 micromoles per liter in 24 hours or by 50% in 7 days, a drop in eGFR by 25%, and/or a decreased urine output. Finally, patients who experience a drug-induced kidney injury may need to have their medication doses decreased or stopped altogether.
Application in medicine. Methotrexate is a class of medication called antimetabolites. Methotrexate treats cancer by slowing the growth of cancer cells. Methotrexate treats psoriasis by slowing the growth of skin cells to stop scar forming. Methotrexate may treat Crohn's disease. Methotrexate may treat multiple sclerosis and other autoimmune diseases. Another video.
Is extremely effective for treating rheumatoid arthritis and other conditions such as psoriasis. It remains the gold standard treatment within the professional healthcare community and has helped many patients feel better, control their disease, and achieve remission. Taken once a week, methotrexate works by reducing pain and swelling and can slow joint damage and disease progression over time. There is also evidence that methotrexate may reduce the burden of heart disease in rheumatoid arthritis. There are two ways to take methotrexate, either as a tablet or an injection. Tablets enter the bloodstream through the digestive system. However, injectable methotrexate avoids the stomach and intestines, which may reduce side effects like nausea and diarrhea in some patients. You might be aware that methotrexate is also used in some cancer treatments. It's the same drug, but the dosage levels used are very different. Most people are greatly helped by methotrexate and cope with few, if any, problems. But like all drugs, methotrexate can cause side effects, and your doctor or nurse will closely monitor you for these. One concern some patients have when prescribed methotrexate is hair thinning. Hair thinning is a possibility, but it's usually slight. Another common concern is feelings of sickness, especially when taking tablets. Fortunately, there are steps you can take to help minimize this. Studies show that taking a folic acid supplement reduces side effects by up to 79%, and changing from tablets to injectable methotrexate is also proven to reduce stomach problems whilst increasing the effectiveness of the drug. As to methotrexate and alcohol, a recent study has shown moderate alcohol consumption of less than 14 units a week shouldn't have an adverse effect on your liver. That means you can continue to enjoy the odd drink while on methotrexate. Just ensure your doctor continues to monitor your bloods regularly. It may take up to 12 weeks after reaching the best dose for your condition before you notice any benefits, so persistence is key. Remember, at any stage, you and your doctor can agree to adjust or swap treatments. A healthcare professional should always be your first port of call for information. There are also advice helplines, websites, and patient groups to help answer any questions you may have.
Now, pros and cons. You have pros. Methotrexate treats cancer by slowing the growth of cancer cells. Treats psoriasis by slowing the growth of skin cells to stop scar from forming. Moderate treatment arthritis by decreasing the activity of the immune system. This will help AC symptoms like joint pain, fatigue, redness, and swelling. It might also help prevent damage to your organs and joints. You have cons. May cause very serious life-threatening side effects. It may cause life damage, especially when it is taken for a long period of time. Lung damage, acute tubular injury with numerous intratubular and interstitial deposits of unique appearance. Acute renal failure can occur even the absence of toxic methotrexate levels in plasma 24 to 48 hours after infusion. We have another video.
Lola, a rheumatologist with Rheumatic Disease Center Physicians. What can someone expect when they're started on methotrexate? They can expect to have a medication which they tolerate quite well, and over a period of time, they begin to notice an improvement in their stiffness, their pain, their fatigue. Their energy improves, the quality of life improves, their dependence on pain-relieving medications lessens, and they get back to a more active life. The medication has some side effects, most of which are mere nuisances and are easily managed by giving a vitamin called folic acid. The nuisance side effects include sores in the mouth, diarrhea, mild hair loss, abdominal pain, and sometimes nausea. There are, however, certain serious side effects that can occur as well. These include a severe form of asthma associated with fever or chronic progressive scarring of the lungs. Fortunately, these are quite rare, are easily recognized, and easily managed.
Now is used in Ecuador. In Ecuador, methotrexate is used for patient suffer these consequences in the body. For the reason, more students must be done so that patient change medication. Finally, conclusion. Methotrexate may cause very serious effects. You should only take methotrexate to treat cancer or certain other conditions that are very severe and that cannot be treated with other medication. And that's it. Thank you for